VOR training is the cornerstone of vestibular rehab. In this video, we're going to think about VOR training beyond beats per minute. When treating patients with vestibular dysfunction, we typically focus on a metronome, 120 beats, 160 beats, but rarely do we discuss what really matters, which is degrees per second. We know the vestibular system's primary job is to stabilize our vision during head movements, and its function is measured in degrees per second. Yet we most often refer to it as per hertz or beats per minute. Now, research tells us to effectively isolate and train the vestibular system, we need head movements of at least 100 degrees per second. Below that threshold, the visual system probably compensates too much, limiting vestibular adaptation or habituation. So let's see what this means in practice. So we have a metronome at 160 beats per minute with plus or minus head movements from side to side about 10 degrees. That's only at 84 degrees per second of peak velocity. At 20 degrees head movements, it's 168 degrees per second of peak velocity. And at 30 degree movement side to side, now we're up to 251 degrees per second peak velocity. So you can see how the larger amplitudes truly challenge the vestibular system at therapeutic levels, and the metronome can be set at a lower beats per minute. When you're prescribing VOR exercises, think about how you want to target and customize at certain velocities. I want to give a special shout out to Dr. Cameron Barine, who has kindly provided you with a chart that you can target and customize treatment by using a table or what you see on this graph. It calculates the precise relationship between the metronome and beats per minute and the head movement amplitude. He provides calculations at 10, 15, 20, 25, and 30 degrees of head movement, and it gives us exactly what we need to do to target those VOR exercises. Now, patients with severe symptoms, very sensitive head movement, you may not be able to train them at the velocities that you want because you're just trying to get them used to the head movement without increasing so much anxiety. So start where you need to, but really think about using a chart like this to customize your treatments for the optimal outcomes. So the take-home message with this and VOR training is size matters.